So here we are today with a patient of mine, a recent patient called Michael. And Michael came to me with a complaint. I'll let him tell you about that, and I'll let him tell you about how he came to see me after his journey, and the effects of the treatments that he's received from me. So, hi Bill. So just tell me about your condition and.
Okay. Well, I had arthritis in both knees, but my biggest problem was my right knee, behind my right knee, didn't enable me to walk upstairs properly. Indeed, I was actually going up sort of one step at a time and putting both feet on the step and then moving up again.
And have you been to see anybody about this?
I went to a doctor first of all, who told me there was nothing wrong with my knee. I was then referred to physio, which I did a complete course of physio. Nothing happened at all. The pain was still behind my knee, and I could still not walk upstairs.
And how long has this been going on for?
Oh, 2 years, possibly, maybe more. I then went to an osteopath who tried to do something and was telling me there was still nothing wrong with my knee. And then I found Patrick, or he found me, I'm not quite sure which way around it was. And I told him of the problem with my knee and where it was, i.e. behind my knee. And strangely enough, he went straight to it and said, that's exactly the place. And told me a muscle was out of position, and within 5 minutes put it back in position. The pain in my knee has now gone, and well, it had gone from moment one. I am not quite unable to walk upstairs yet, only because my right thigh is, the muscle in my right thigh
When you say
is not big enough.
you're not able to walk upstairs yet, how is your walking upstairs improved?
Oh, massively.
So are you still going up one step at a time?
I am, but it's almost to the stage where it's becoming natural to walk up normally, if you know what I mean.
Okay, and coming downstairs is always more difficult than walking upstairs.
Yeah, that's the tricky one still. But it's Patrick has given me exercises for my right leg, and building up the muscle in my right leg, and that's made the difference. So it is starting to get a lot better.
Okay, so if you were sort of out of 10, how you were before you came to see me, operating at what level out of 10?
Well, from the pain, just the pain threshold from behind my right knee, which was constantly there. So I mean, that's got to be a 10 out of 10 because I've got no pain there at all now.
Okay.
From walking upstairs, I would say we're on about 7 or 8.
Okay, cool. And where were you before you came to see me in terms of your mobility and pain, etc.?
Oh well, pain, as I said, the pain behind my right knee was constantly there. I mean, but not when I was at rest, of course, but any moving around.
Do you used to take any painkillers for it?
Yes, I took anti-inflammatories.
Okay.
Constantly.
Okay, and are you still constantly taking them? As many? What's the situation?
I don't take them anywhere near as regularly as I used to. No.
Okay. No. So on the whole, in terms of life experience, how have you benefited overall from the treatment?
Well, massively, because it's, as I say, one, it's not painful anymore, which is a great relief, as you can imagine. Yeah. But once I've built up the muscle in my right thigh, I'm hopeful that I can just walk upstairs quite normally and downstairs. So that should be the end of it, hopefully.
Yeah. Thank you, Michael. Well, Michael, a typical story, a gentleman who has come to see me after making various stops on his journey to remediation of a long-standing issue, having reached a dead end in many situations. Yes, we were able to look at his ambulation, his posture, and we were able to put our finger on exactly what the issue was and remediate that quite quickly. He's benefited tremendously from an increase in sort of lifestyle and ability, and of course taking less medication. Thank you again for listening, and thank you, Michael.